I'm Dr. Siddharth Kudav. I'm a general and bariatric surgeon here with Advanced Surgical and Bariatrics of New Jersey. I specialize in laparoscopic and robotic bariatric surgery, as well as general surgery and foregut surgery. Seeing a lot of patients struggle with obesity and obesity-related problems pushed me to try to find ways to help. I became very passionate about bariatric surgery during my training years. Obesity is a pandemic, and this is a pandemic that has required significant treatments. Unfortunately, over decades, it was not treated appropriately and it wasn't treated aggressively enough. Today, we finally understand that it needs to be treated for what it is. It's a life-threatening disease. Bariatric surgery is a powerful tool. It's a powerful treatment for the disease of obesity and metabolic problems that come with that. With weight loss and with these metabolic improvements, we see decreased risks in multiple types of cancers, sleep apnea, asthma, fatty liver disease, and virtually any number of other medical problems that can lead to shorter life expectancy and decreased quality of life. My favorite part of my job is seeing patients a year after surgery when they feel like different people, when they look like different people, and they feel like their lives have changed. And that change lasts long term. As a general and bariatric surgeon, I'm excited every day to help patients.